Everybody should be muted now. First I want to I started the recording. I'm recording this. So welcome everyone, and thanks so much for joining the first in a series of webinars about the climate crisis. For those of you who don't know me, my name is Ginny Rogers, and I'm one of the leaders of the Ann Arbor chapter of Citizens Climate Lobby. Maybe a lot of you already know about CCL, but for the benefit of anyone who doesn't, CCL is a national, nonpartisan, grassroots organization focused on passing effective national legislation to tackle climate change. We favor a policy that places a steadily increasing fee on fossil fuels and returns 100% of the revenue in equal payments to every American as a monthly dividend. We are pleased that such legislation was introduced in the US House in January last year. It's called the Energy Innovation and Carbon Dividend Act, or HR 763. And we are working to build support for this bill. Of course, because of the COVID-19 crisis, our legislators are currently preoccupied with the huge impacts of this pandemic, and we are holding off a bit in our advocacy until they have a bit more capacity to deal with other issues. And like everyone else, we have had to shift the way we work. And so we are pleased to present this climate crisis webinar series. Most of the talks in this series were originally scheduled to be in-person events in mid-March, and they had to be canceled as the pandemic began to unfold in Michigan. I will post a link to the chat to our Eventbrite page where you can learn about the other webinars in this series. Before I introduce our speaker tonight, let me briefly explain how we're going to run this. All participants are currently muted so that we get rid of all the distracting background sounds. And we're going to hold all of the questions until the end, but we will allow plenty of time for Q&A at the end. When we get to that point, there's two ways to ask questions. You can write your questions in the chat, or you can do that at any time. And you can find the chat icon at the bottom of your Zoom window. And then when we get to the Q&A period, you can also ask a question by raising your hand. To raise your hand, there's a icon. You first click on the participant icon at the bottom of the screen, and then you should see a button that says raise hand. So if you do that, we will call on you and unmute you so that you can ask your question. Now, let me introduce our speaker, Dr. Larry Junck. Larry is a professor of neurology at the University of Michigan and is a founding member of the Ann Arbor CCL chapter. Larry has been involved with the climate movement for many years. I think I first met Larry in the context of his climate work at a rally, an anti-Keystone rally in downtown Ann Arbor in early 2014. In addition to his involvement with CCL, Larry also founded the Climate Crisis Action Group at the First Unitarian Church and has been integrally involved in pushing the University of Michigan to make bolder climate commitments through his work with a group called Voices for Carbon Neutrality. Larry has given many talks on the health impacts of climate change. So thank you, Larry, for making the time to speak to all of us. And now let me turn it over to you. Go ahead and share your screen, and let me make sure that you're unmuted. Okay, you're unmuted now.
Okay, thank you, Jenny, and thanks to Citizens Climate Lobby, and I believe Climate Reality is also listed as a co-sponsor. Thanks to Climate Reality for helping to sponsor this event. So I'm going to talk about the relationship between the COVID infection, health, and climate change, covering three topics, of which the first that's listed here will take the majority of my time, talking about relationships between the COVID pandemic and climate change, then going on to talk about how the pandemic presents us with opportunities to advance action on climate, and also how climate activists may proceed during the COVID pandemic. So first, talking about relationships between the COVID pandemic and climate change. On the lower left, you see a artist's conception of the virion, which we've all seen too many times. And on the right side, a chart of global temperatures, which are rising and rising. So on the topic of relationships between COVID and climate change, I'm going to cover 4 topics. One is deaths, lots of deaths. Another is air pollution, which is a topic that I'm very concerned about and which you'll hear me mention repeatedly. Third is ethnic differences in susceptibility for these 2 problems. And fourth is the concept of flattening the curve. Deaths. So across the top, you've all seen death figures for COVID. If you are glued to the news like so many of us are, you get these as often as daily. Worldwide, the deaths are now at about 280,000. In the US, deaths have just surpassed 80,000. And in Michigan, they're at about 4,500. In contrast, let's compare that with deaths caused by air pollution. And air pollution is just one aspect of the burning of fossil fuels, but it's an enormous one. Climate change, of course, is related to the burning of fossil fuels in large part. And it's not, air pollution is not so much a consequence of climate change as together they are both consequences from the burning of fossil fuels. Annually, air pollution causes about 4.2 million deaths estimated worldwide. And that's all just ambient air pollution, outdoor air pollution, if you will, neglecting indoor air pollution, which is largely confined to third world countries from burning substances in the kitchen to cook food. Deaths in the US from air pollution are estimated by WHO at about 78,000. That figure's only approximate. There are figures that go as high as a couple of 100,000, but I think a figure that's closer to 100,000 is probably closer to being correct. By coincidence, the deaths from COVID, probably just in the last 24 hours, surpassed that figure listed for air pollution deaths in the US per year. The number of air pollution deaths in Michigan is not well known. I estimated the figure based on the assumption that it's proportionate to national deaths, which would give us a figure in the ballpark of 2,400 per year. I want to introduce to you a bad actor. I already introduced the bad actor, which is the COVID virion. The new bad actor I want to introduce is the PM2.5 particle shown in your upper left. So this is a particle that arises by chemical processes after combustion. And it's actually got a little bit of a complex structure. It self-assembles in the effluent from burning of fossil fuels. The 2.5 refers to its maximum size, 2.5 microns. So they are pictured here in the lower left as a series of little red particles lined up. They are far smaller than a grain of salt. They are smaller than a grain of pollen. And they are quite a bit smaller than a human hair. Their main sources are from the burning of coal in power plants and from vehicle exhaust. Shown on the upper left is a map from an article by Dye, New England Journal of Medicine, 2017, showing annual PM2.5 concentrations across the US. They are fairly non-uniform, centered heavily across the Midwest and the East, except with pockets of very high concentrations over the Los Angeles area and the Central Valley of California. Dye did a study of 61 million Medicare recipients. It covered almost all Medicare recipients across the country, collecting data over a period of 7 years, and during that time analyzing 2.6 million deaths. Big study. And in this study, they looked at risks related to PM2.5 exposure. For every 10 micrograms per meter cubed increase in PM2.5, they found a 7.3% increase in death. Now, to put the 10 microgram per meter squared concentration in perspective, in the map on your upper left, the concentrations range up to 14. 12 is considered the upper safe limit, and Michigan, along with other states in the Midwest and the East, is very often hovering around or above that upper safe limit. But that difference between, let's call it a low concentration of PM 2.5 and a moderate concentration of 2.5 would give you a 7% increase in risk of death related to that particulate exposure. There are large differences related to race and sex, and I will show those to you on the right side of this slide. And this is something I must say, when I give a talk like this, the person who learns the most by far is me. As I dug into this article and found that I had not been aware what a big ethnic difference there is related to PM 2.5 exposure. And this is not meaning that African Americans are exposed to more, which may be true, but it's mean that to the extent they are exposed, it affects them a lot more. So on the right panel, let me show you, first of all, for a white woman, the increase in death related to that degree of exposure is about 5%. For a white man, it's about just shy of 10%, I believe. No, it's just shy of 7 or 8%. And for a black woman, it's up at about 17%, and for a black man, it approaches 25%. So a big difference between whites and African Americans. This study did not include data on other ethnic groups. They did adjustments for other cofactors and found that they would not influence this conclusion. This is the kind of study and the kind of conclusion for where one would normally want to see replication. You'd want to see other studies. And there's other studies that may show similar kinds of findings, but this was such a huge study, 61 million people. It's not realistic to expect somebody else to go out and find another 61 million people to study. So the question can be asked, what do these people die of? And the answers are on this plot. The year 2015 is the most recent year portrayed in this study from The Lancet, which is a respected medical journal, where the biggest increase in causes of death was for heart disease, shown here in pink. That's followed by 3 other conditions that all make fairly large contributions to the excess deaths from air pollution, from pneumonia, from chronic lung disease, and from stroke, with a smaller contribution from lung cancer. Tough question is, how can inhaling these particles, which go deep down into the lungs, cause heart disease, stroke, and other health problems? It seems obvious how it can cause lung disease by directly causing inflammation in the lungs, damaging the lungs. The means by which these affect other organs is almost certainly not by these particles getting into the circulation, but rather by indirect effects that are not yet well understood. It's probably related to inflammation. When there's inflammation at one site in the body, that's known to have an increased chance of causing heart disease and other diseases elsewhere. And these PM 2.5 particles are probably having their adverse effects by causing inflammation in the lungs, affecting other organs. One could make an analogy between this and the effects of cigarette smoke, or even a better analogy would be secondhand smoke. As most of you know, if you live in a household with a smoker, sharing household spaces, vehicles, or sharing workspaces with a smoker, you have an increased risk of having complications, similar to those in a smoker, except not as high. To me, that seems fairly similar to what happens with particulate inhalation. The question can be asked, given that exposure to particulates increases the risk of pneumonia, might it increase the risk of doing badly with COVID infection? And of course, we're very early into COVID infection, but the medical literature is totally alive with studies already that are addressing a lot of different questions about COVID infection, including this question, whether air pollution increases the risk. This is a study that's not yet published by Wu et al. In the upper left is shown countywide averages for PM 2.5 over a 16-year period. And you can see that Southeast Michigan does show up as a spot of relatively high exposure on this plot. And on the right is a plot of COVID deaths per million through April 22nd. And the authors correlated these findings and found that there was a significant correlation. Their study included 98% of the population. They adjusted for covariates. And what they found is that for every a 10 microgram increase in PM 2.5, 8% increase in risk of COVID death compared to another person who had lower air pollution exposure. So it's, while this study is, must be taken fairly lightly because it has not yet been published, it hasn't been through peer review, but it was done by a respected group at a good school. And undoubtedly, there will be more data emerging on this. So something you may have seen in the news is that COVID exposure may be more risky to African Americans than to others in the population. This first came out a bit over a month ago in the state of Michigan. And one of the findings was a higher death rate in our neighbor Ypsilanti, right next to Ann Arbor, compared to Ann Arbor, with that being attributed to higher number of African Americans. The latest statistics I found for Michigan, actually these are from a study that's several weeks old, showing that in Michigan, African Americans are listed as 14% of the population, but account for 33% of COVID cases, 40% of COVID deaths. Other studies have come out looking at other cities and states that also reported increased risk of bad outcome from COVID in African Americans. And yet, in preparing for this talk tonight, I was able to dig and find the latest update from the CDC. And they update this data weekly, so this should be as recent as anything that exists. And actually, this trend is starting to fade away. So let me walk you through it. And the upper row of numbers are the percent of deaths in the US that are in various ethnic populations. And in the second row is the percent of these ethnic populations as a percent of the American population weighted for the cities where the COVID exposure has been occurring. For whites, the white people have had 52% of the deaths in the US, whereas in this study accounted for 40% of the population. And whites were actually at slightly increased risk, the highest of the population studied. Blacks, African Americans had a slightly elevated crude risk ratio of 15% increase. And interestingly, Asians had a rather low risk, and Hispanics also had a rather low risk. So these data from the CDC are not strongly supporting the data that's been in the media. This is the CDC data specifically for the state of Michigan, the same type of data that we just looked at. And whites in Michigan account for 61% of the deaths, but 60% of the population. So really about the population average. Non-Hispanic blacks, 33% of the deaths, 27% of the population. Some increase in the state of Michigan, it's looking like. And again, Asians lower risk and Hispanics lower risk. You could ask the questions, what factors might contribute to differences in ethnic risk? It could be, if it's higher in African Americans, as it might be in Michigan, it could be related to a greater chance of living in urban residences, therefore being in proximity to more people, possibly having smaller homes, possibly having more exposure in workplaces. I suspect it's true that African Americans are less likely to be able to work from home than white people, for example, might. And the air pollution itself, as already mentioned, may be a factor. In African Americans, medical risk factors could play a role. They have a higher incidence of obesity, hypertension, and diabetes. There could be factors related to medical care. For example, there may be less access to medical care in the community, less insurance coverage. There may be reluctance or mistrust of the medical system. Whether there's a lower quality of care provided, I don't know. I can tell you in my work at University of Michigan Hospital, I don't see that at all. I'm very proud of the job that is done by everybody I work with, who I think does their very best to deliver a high and equally good quality of care to all ethnic groups. Why do we care about ethnic differences? First of all, if we want to prevent COVID deaths and infections, finding the populations with a high incidence provide us with a good opportunity to work on that. Another is that understanding the differences in incidence and death may help us to understand the means of spread and susceptibility. So this ties in with the sort of detective work that is done by epidemiologists to better understand how these diseases spread. And understanding differences between ethnic groups can give us clues to those differences in spread. And finally, our own Pledge of Allegiance ends up with the phrase, with liberty and justice for all. And if there is injustice that is part of these differences, and I don't know that there is, but if there is, I think as per our own Pledge of Allegiance, that deserves our attention. So how can we sort out these ethnic differences? And so far, I think the most striking ethnic difference is that Asians and probably Hispanics may have a lower risk. First of all, if you're looking at risk of death versus risk of infection, those are two different things. If a group had a higher incidence of both death and infection, that would suggest that their location may put them at higher risk, the location in their residences, in their workplaces, etc. On the other hand, if the mortality is higher in diagnosed cases, that means that medical risk factors or differences in medical care or in access to medical care may account for the difference. Contact tracing should be very informative, and our country should be doing a whole lot of contact tracing. But everything I've heard about contact tracing is that we're gearing up to do it in the future, and I haven't heard any results out from contact tracing as applied to studying populations. Results of such information could help us to deal with this epidemic. It could help to guide us as to whether we should be emphasizing social distancing, whether we should be working on better access to medical care, or whether we should be educating populations when to seek medical care. I want to sneak in brief mention of other aspects of health problems from climate change. So I don't intend in this talk today to cover everything that I could cover about health problems related to climate change. I could give a whole talk about that. But here I have just listed some. And some of these are things that are ongoing now, but most of these are things with the potential to be greater problems in the future. Infections are a big one, including infections such as malaria, dengue, Lyme disease. So Lyme disease has hit Washtenaw County, and that increase may be related to climate change. And you all know about Zika infection, which came up from Brazil. Infantile diarrhea could be a big one. Direct heat deaths during heat waves could increase. Displaced populations can be a big cause of health problems with poor sanitation, unclean drinking water, spread of infections, and people who are separated from their medications and health care. Separation from medications, even for days, can be life-threatening in people with problems such as diabetes, hypertension, epilepsy. Flooding and drought, both of them can be problems in different locales, threatening health. Failure of food supply, mental health problems, and violent conflict may increase. So flattening the curve. We all know about flattening the curve in relation to COVID virus. And what's plotted here from the New York Times are the curves of COVID virus infections, except they did an interesting thing. They separated out New York City, Detroit, and New Orleans from the rest of the country. We've all thought that our curve has been flattening across the country and that we're heading into a downslope. But it turns out that the downslope is mainly accounted for by Detroit, New York, and New Orleans. And I believe that includes the entire Detroit metropolitan area. The rest of the country could be heading into either a second uptick in cases or perhaps just a continuing. One gets the feeling that as states that have done better social distancing are decreasing their risk, the COVID infections are moving out to other places, moving out from urban areas into rural areas, advancing in states that have not done so well at the social distancing. So here the hypothesis, my hypothesis, is that social distancing may account for the difference between New York, Detroit, and New Orleans, which are decreasing their rates compared with the rest of the country. Reasons we want to flatten the COVID-19 curve: to save lives, to keep hospitals from being overwhelmed, and to buy time until the hoped for vaccines or cures of a disease may become available. So with climate change, you could also think of this as an area where we need to flatten our curve. And here, there's no question that we haven't even started to flatten the curve at all. So on the left are temperature curves. These are from NASA, and they used 5 different sources of temperature information, which all coincide very, very closely, showing that worldwide temperatures are continuing to rise. We have now reached and slightly surpassed 1 degree centigrade, 1.8 degrees Fahrenheit. On the right are pictures of the temperature anomaly, which is variable across the world, greatest in the Arctic regions, followed by the Antarctic regions. The Intergovernmental Panel on Climate Change in their 2018 report says that if we want to limit the worldwide temperature increase to 1.5 degrees C, we would have to decrease greenhouse gas release by 45% by the year 2030, another decade, and to eliminate it completely by the year 2050. So these are ambitious goals that would require us to flatten the curve, and you could think about the curve as representing either greenhouse gas release or temperature increases, where the temperature increases will lag way behind the increase in greenhouse gases. Reasons to flatten the temperature curve are all the bad outcomes from climate change with which many of you are well aware, including consequences such as health problems, loss of biodiversity, effects on our food supply, extreme weather events, rising oceans, and others. So I'd like to talk briefly about how COVID can prevent us with opportunities to advance action on climate. One possibility that comes to mind is simply the public perception of science. And I think since the COVID infection has been prevalent, it has been very clear that people are looking to science to provide answers. For those who think that science has been in a state of disrespect, I think that attitude may belong mainly to certain leaders and not to the American public. I think there's little doubt that the American public is really looking to science to give us guidance, to give us understanding of this virus, to teach us how much social distancing might help, and to work on those vaccines and cures. Another is that the public is working together with leaders to help deal with this problem. I don't know about you, but when I walk outside and see my neighbors and see other people in any place I go to, I get the feeling with everybody who I'm interacting that they feel like we're all in on this together. They all want us to work together. They want us to work with our leaders. This applies to leaders who are giving us good advice, and it sometimes applies to leaders who are giving us bad advice. Reasons that have been given in other parts of the country for not doing social distancing include that the president hadn't given us strict directions for doing social distancing. And in those states, the people are following that particular leader, even when the advice may not have been good. Actions can be successful, so we can act jointly to deal with problems, including both the COVID pandemic and climate change, and achieve success. Success so far with the COVID, of course, is very preliminary, but a few slides ago, I showed you how we're starting to flatten the curve better in regions which have done better social distancing. And I think there's a lot of data and a lot of perception that social distancing is a successful strategy. During this pandemic, citizens are learning some good habits. We're learning to travel less. We're learning to connect remotely, and that's a new skill for me, and it's probably a new skill for you, and we're getting better at it. And I think that can help us to do less traveling in the future. And we're also buying less stuff. And I think perhaps we can continue that habit of buying less stuff, maybe having slightly simpler lives as we move forward. Another aspect in which this can influence us is that we can be inspired by the cleaning of the atmosphere that is being seen at many places around the world. And on the lower right, you see pictures of Los Angeles on a typical day during COVID, prior to COVID, and on a recent day during social distancing. And there's data and pictures like this from around the world showing how the atmosphere is being cleaned up. Last thing I want to cover very briefly is how do climate activists proceed during COVID? So on the lower right, you see a picture of 800 citizen lobbyists with Citizens Climate Lobby visiting the state capitol. And a tough question is, what do we do during this period of COVID pandemic? One must expect our legislators and our leaders to be less willing to put this on their front burner, to give it their full attention, and to make major changes moving against climate change right now. And yet there's still things we can do. So things that we probably don't want to do right now are to push hard for passage of legislation in Congress. And in showing you these ideas, I have to confess, I have no more expertise than probably most of you do about this strategy. I pay attention to what the leaders of Citizens Climate Lobby say. I think they have smart people who know legislative strategy and lobbying strategy and strategy for influencing the public. Requesting new legislative meetings, maybe yes, maybe no. You might have trouble getting your legislators to be quite so interested in climate change as they might in another era, or to start new initiatives with political leaders. And yet CCL is having its annual lobbying day in June. And what makes that difference from scheduling new meetings with legislators is that that's something our legislators expect. We meet with them every year in June, and this year lobbying day goes on. So there's kind of a background and an impetus for doing that. Letters to the editor and op-eds probably still have their role, almost certainly do. Keeping connections alive with our groups and other people who are interested and concerned about climate change, talking to friends, getting new people aware of our concern about climate change and knowledgeable about this issue. Educating ourselves, and that's what we are all doing right now at this very moment. And I already told you that preparing for this talk involved me educating myself in some new ways, building our local groups, and for people who are knowledgeable and experienced at being advocates for climate change, using our good judgment. So a partial list of conclusions that I want to present to you, first of all, related to air pollution. This is a grossly neglected cause of morbidity and death. And deaths from PM 2.5 air pollution disproportionately affect Blacks, African Americans. Climate change is a much bigger problem than COVID. In 2020, right now, it's not a bigger problem in the public perception, but climate change goes on, and it gets bigger and bigger. It has a prolonged time course. It is grossly neglected by the American people and their leaders. Opportunities, the COVID pandemic, especially once it's under control, may facilitate actions against climate change. Thank you very much.
Wow, Larry, that's fascinating. So just to remind everyone that if you want to ask a question, you can type it in the chat, which the chat icon should be at the bottom of your Zoom window. Or if you would like to raise your hand by clicking on the participants icon, and then you should see a raise hand button, then we will call on people and then unmute you so you can ask your question. Let me just start off by asking Larry, do you think there's any reason to think that another pandemic or another novel virus would be more likely under climate change?
Good question. So I think background for this pandemic is that the world is so much more connected than it has been in the past. People are flying around the world. An infection that might have started in China a number of months ago gets transmitted quickly to other centers. But I think that's the biggest factor that predisposes us all to future pandemics. I think lung disease related to air pollution could be a factor that makes us more susceptible.
Okay. Craig asks in the chat, says smokers have been found to have lower risk of severe COVID infection. Guesses are that this is a result of nicotine. What are your thoughts as to how this might be used in treatment?
Wow, I did not come across that. And I don't think I'm prepared to speculate about that. I would have guessed that they would have had a higher risk. You know, one answer is I'd like to see the data, and I'm sure that data about this is fairly immature at this time and will become more mature over several months. I can't think of a reason that nicotine would alter one's risk of either getting COVID infection or having a bad course with it. I want to see more data. Thank you for bringing that to our attention.
A lot of compliments and a nice talk in the chat. Marie asks if you would be willing to share your excellent slides.
Yes. How shall I do that?
If you get them to me, Larry, then we can send a link to everybody who registered for this talk.
Yes. I'd be happy to do that.
Syed asks, do we know how much COVID-19 and social distancing has slowed the global warming process?
So the answer is, I don't think we know that in detail, but the answer is going to be not by very much. It's been about a month since I saw that the amount of decreased fossil fuel use. So right now, everybody's lifestyle has us using less fossil fuels temporarily. Air travel is way down. Vacation travel is way down. Fewer people are going to work, and some people use quite a bit of fossil fuels going to work. Some workplaces themselves are shut down, perhaps not having to operate a furnace. So those are factors that contribute to a decrease in fossil fuel use temporarily. About a month ago, I saw a study suggesting that that decrease that was well underway at the time was enough to decrease the fossil fuel use or greenhouse gas production by about 19 days, or to delay the curve by 19 days. In other words, by only a trivial amount. And of course, that's subject to certain assumptions, assuming that it will get back up to where it to previous levels in upcoming months. I actually don't know the assumptions used in that study. Certainly, I don't think anything that's happening now is going to be adequate to alleviate our concerns about climate change. I think it's very important that we keep action going to deal very seriously with climate change, as per the IPCC has suggested.
Okay. Scott has raised his hand. Scott, I think I've unmuted you. No, not yet.
There we go.
Okay, go ahead, ask your question.
Hi, Larry. Thanks a lot.
Thanks, Scott.
That was really helpful. I appreciate what you said as far as one of the benefits of COVID might be people's view of science. I must admit, I'm much more right now a cup half full on that. In fact, if anything that has been bothering me, it's that I have the opposite impression. That is, I have the sense that here's something right in front of us. You can measure it, you can see it, and yet we're still not many people believing the scientists. And I can say that firsthand from a lot of the people I know, and I'm finding it quite frustrating. The idea that doctors are purposely inflating deaths and saying that things are due to COVID that wouldn't, when the data is right in front of us that that's not the case. So long-winded question is, do you have data to support that, or have you seen any articles that people's view of science is being influenced by the COVID? And one thing I'm interested in is maybe a way to make that happen.
I have not seen data on that, and I'm sort of jumping to conclusions when I say that based on perceptions. You know, I've picked up the perception that when President Trump has been when he was giving daily press conferences going on for an hour and a half with Anthony Fauci standing at his side saying nothing, that a lot of people were saying, we really want to hear what Anthony Fauci has to say more than what you want to have to say, President Trump. But that's not data, and there could be two sides to this coin. I think people who think that the COVID pandemic is made up or that the numbers are being made up have they must be in a distinct minority. I think there's absolutely no basis for that line of thinking. But we'll see how it plays out.
Okay, Peter asks, if COVID-19 plays out over a long period of time, there's a suggestion of possibly 2 years. How would that reality change our strategy in advocacy for climate change?
That's a tough question. And as I said on one of my last few slides, I'm not an expert at answering that question. I think it would make it harder to implement big changes in dealing with climate change. And I think it's very important that we keep climate change in the conversation over whatever period of time it takes, even if it's as long as 2 years.
And here's a follow-up question from one of the earlier questions. What sources would you recommend to track the impact of COVID-19 on the environment?
That's a tough question. So effects on the environment, so that could include what's happening with the burning of fossil fuels during COVID. I actually don't know a good source on that. You know, sources that I trust include CDC and NASA. NASA has a website that continues to have good information. And one thing that has been remarked on by the media is how NASA continues to put out good information. I think the information they put out is reliable. Perhaps they don't put out as much information as they might or as we'd want them to. I think the information they put out is trustworthy. World Health Organization, I think, is a trustworthy source, and NOAA, National Oceanic and Atmospheric Administration, is another government agency that's involved. On the other hand, the kind of information that you might want, such as what's happening with fossil fuel consumption, might be very hard information to come by.
Just let me add on that I saw recently a graph, I think it was a plot of the Keeling curve, which is a measurement of the concentration of CO2 in the atmosphere. with an overlay showing the normal path that we would be on with the projection of, or with the current measures due to, you know, the slowdown in the economy during COVID. And it's just a very slight decrease. I'll see if I can find that chart and send it along. Okay, Ruth asks, how much of a time lag is expected in the CDC data set, i.e. reporting to CDC on deaths, incidents from locations around the country?
My impression is that that happens fairly promptly. I don't have inside information on that, but I think it's pretty prompt and pretty up to date. One thing that can happen is delays in diagnosis. Possibly a bigger factor than delays in reporting is delays in diagnosis. So if a locale suddenly starts doing a bunch of testing, they will find a bunch of new cases. And the new cases won't really represent an increase in incidence. It will just represent an increase in testing. I think that kind of happening may have been documented around some of the meat packing plants, where a locale will have an outbreak at a meat packing plant, and they do a lot of testing and find a lot of cases. And there's general agreement that there's quite a few cases, a lot of cases out there that we don't know about that are not being reported or tested. And so the numbers partly are influenced by that.
Here's a comment from Nadine regarding an earlier question, and that is Inside Climate News, which is an online news source, has had numerous articles about the impact of COVID on climate. So that would be a good place to check online. Leah asks, I've heard commentators speculating that once restrictions are lifted, folks will have pent-up desire for goods and services, and this will negate any gains in lowered fossil fuel use. Thoughts?
Wow, I think predicting consumer behavior is one of the things I'm absolutely least expert at. You know, whether people will go back to their previous ways or whether they will make up for lost time, you know, either of those are possibilities. So the cruise liners are starting to open up. They're starting to sell tickets for cruises in, is it July, August, thereabouts, I think. And, you know, you can ask the question, will people sign up for those in great numbers because they missed the opportunity previously? That's an example where I'm going to agree with Jenny shaking her head. No, I don't think that'll be one of the last things to happen. I think conferencing. So several times a year, I attend medical conferences, which are usually an airline flight away. And I think that will, I think there will be a cultural change, and it'll be very interesting to see how that plays out. This year, many of these conferences are totally happening online, often at a very diminished level. I don't think that the educational experience will be nearly as good as it would having everybody appear live, but maybe we will get better at this, get better as individuals, get better at organizations. Maybe companies will get better at interacting with their associates, their customers, their suppliers, their branches, and so maybe transportation, long distance transportation will go down, and that would be a very good thing because long distance transportation is one of the very toughest nuts to crack with climate change.
Marie has posted in the chat a Pew report about that came out before COVID about mistrust in American views of scientific experts. So for anybody who's interested in getting any information that's posted in the chat, just you are able to copy and paste things, but another option for doing that is if you click it, there's a little icon at the bottom of the chat window with 3 dots. And if you click on that, there's an option to save the chat, and that will save it to your computer. Somebody asks in the chat, I've been hearing a lot of concern about the accuracy of morbidity numbers. I'm hearing that 1, hospitals get more money if the numbers are high, so there's bias. And 2, those who died but weren't tested and showed COVID symptoms were assigned as deaths to COVID, or the opposite. Those who died and weren't tested weren't assigned as COVID deaths, even if they were. How reliable do you think the reported numbers are?
Wow, I tend to think the reported numbers are fairly reliable, but again, I don't have inside information on that. I think testing is to the point. So at my hospital, every patient admitted to the hospital gets a COVID test, symptoms or no symptoms. That's for several reasons. First of all, COVID can present with unusual symptoms, but more than anything, it's to protect the staff from patients who might have COVID infections, so that distancing can be taken to a higher level, that personal protective equipment taken to a higher level for somebody who might be carrying COVID infection. And also, I think it's maybe to the patient's benefit to be in a hospital is a place of a bit higher risk of acquiring COVID, and it helps to know whether they have it when they come in. So I think at my hospital, I don't think cases would be likely misdiagnosed if the testing is accurate. And thus far, I think the testing, of course, there can be lags in positive reports. There may be cases that test negative who have COVID, but I think the testing is mostly reliable, and I think the reported numbers are mostly reliable.
Ruth also has a comment regarding information. She says that GRIST also has reporting on COVID and climate news. Hugh says, a counter argument to the pent-up demand is that even when there is loosening of restrictions, people will be both reluctant to return to travel and will lack the resources to do so with the economic depression underway. Jacob says, if we take an upcoming economic depression as a certainty, could the effect of COVID-19 on climate change be a matter of the relative cost of renewable energy versus fossil fuels as the virus slows down?
Read the last part of that again. Could the
effect of COVID-19 on climate change be a matter of the relative cost of renewable energy versus fossil fuels as the virus slows down?
There's some very tough questions in there. So, we'd all like to see sustainable energy advance. So let's assume that COVID lingers for a year or two in various forms, possibly goes through more waves of infection, possibly causing a depression. Fossil fuels could be cheaper, as they are right now. That could lead people to be quite willing to burn fossil fuels. It could lead people to be less motivated to take on dealing with climate change. I think it's very hard to predict how that's going to go. I think the one thing I feel most strongly in is that any scenario you plan for that is not going to provide anything close to a satisfactory answer to dealing with climate change over the next year or two. Once again, I'm taking the IPCC suggestion seriously. We need to be down by almost half by 2030. And even at a time like right now, I don't know how much down fossil fuel use is right now, but it's not down by half. So we got a long way to go to get it down by half by 2030.
Okay, there's a couple more comments in the chat. Mark says, there's data on belief in science. Every survey that I have seen shows that 70 to 90% of people believe the scientist and are concerned about opening too soon. rather than restoring the economy. Only about 40% of people believe Trump on COVID, much lower than any other major source, according to a Yale George Mason survey. And there's a link to that in the chat. Thank you. And Hugh says, polling data on trust, Fauci versus Trump is, there's a link to a report on that.
And the report favors Fauci as the more reliable source. Hugh can give us an update on that.
Yeah, this is just a, let's say it's an Economist YouGov poll, May 3rd to May 8th, 2020. It's difficult to summarize table after table in it, but essentially something like Fauci's trust rating is more than twice that of Trump's, broadly speaking. You can go to it's like page 85 or 86 of this report, or you can see it summarized on 538.org or .gov. But I don't, broadly speaking, I would agree with the statement that a broad cross-section of the population really does trust science more than they trust non-scientists who speak on this. Unfortunately, there's a persistent minority who don't feel that way, and at least infection-wise, that's going to be a problem for us.
Thanks, Hugh. Peter has a question. Some experts are saying that we can expect 70% of the US population to be infected by COVID-19. Any suggestions of how to maintain a resilient CCL chapter if we ourselves are dealing with illness?
70% is a very high number, and that the total number infected around this country is less than 0.5% of the country, I believe, has been infected. So just imagine how far this would have to go to infect 70%. It would either go through one enormous wave, or it would go through wave after wave after wave after over years. And most people will survive, and CCL members will survive, and we will continue on.
And we'll look out for each other first thing first, I think. And Robbie has a link to a Snopes report on the problem with study reporting smokers less likely to get COVID-19. Okay, have to look that up.
Thank you, Robbie.
Clark wants us to remind everybody that next week's presentation, which is going to be at the same time, same place, same Zoom line, will be Climate Change in the Great Lakes, Challenges and Opportunities by Chris Olson, who is active in many climate areas here in Ann Arbor and with the Washtenaw Climate Reality Chapter, as well as Citizens Climate Lobby. Gabrielle says, to Scott's previous question, while I certainly commiserate, I don't necessarily think that less people are trusting science and data, but rather deniers are just louder and maybe more organized. I think it's going to force all of us to step outside of our comfort zones virtually while socially distancing and appropriately confront those who are promoting fake news. Let's see,
that comment pertains to the demonstrations in Lansing, who are made by a very tiny, very loud minority.
Ken has a question, and Ken, go ahead, you're unmuted.
Thank you. I very much agree with what I take to be your thesis, Larry, that really climate change is a much bigger and more permanent issue than COVID. And that probably the immediate effects on the climate change of, forced restrictions on consumptions and stuff are fairly trivial and hard to predict if they will continue. But that the big deal will be if COVID causes us to make serious changes in the way we live, some of which you've enumerated. I'm wondering if you have any thoughts on what we can do, since this is a local meeting here, what we can do locally to, in effect, make use of what we're apparently learning from COVID to actually make changes or inspire changes or promote changes that would make a difference longer term in the climate.
The thing that comes to mind is the Ann Arbor City Council actions right now. So I said this is probably a bad time to initiate major new climate actions, but the city of Ann Arbor has a major climate action that is underway. And since it already has its momentum, I'm a strong believer in sustaining that momentum and pushing that forward. And I don't think anything about COVID will interfere with that. So
is there anything you would like to urge those 50 of us who are on this call to do to facilitate what's going on in the Ann Arbor initiative?
So there are messages out there about things you can do. This would apply especially to those who are residents of Ann Arbor, to message the city council and tell them that on May the 18th, you hope that they will adopt and fund the A20 plan. And another is that there are free yard signs being distributed. And those would apply best to people who are in Ann Arbor, but they contain a generic message that could apply elsewhere as well. So get your lovely yard sign. They're being distributed in the next few days. And another one I'm going to say is be an opportunist. Look for areas where you can speak out in a useful way. And the Ann Arbor action is just probably one example of an issue that does remain on the front burner, where people can effectively be outspoken right now. And I think people who are thoughtful about this can find other arenas in which they can use their good judgment and be effectively outspoken right now.
Great, thank you. And somebody put in the chat a link to the Ecology Center's petition for the carbon neutrality plan. So if anybody hasn't already signed that petition saying that you support the Ann Arbor carbon neutrality plan, I encourage you to find that link and sign it. And I'm going to put in the chat right now a link to the form you can fill out to request one of the yard signs. And I think Nadine just put it in the chat too. Okay, well, we're at 9:05 right now, and so I don't want to keep anybody. Thank you, Larry, so much for your great talk. I think we all learned a lot, and we really appreciate everybody tuning in and hearing your talk, and we hope you'll sign up for another event next week.
Thanks, Jenny. Thanks, everybody, for participating.
Good night, all.
Good night.
And for anybody who's still on and asks, yes, we will send a link to the recording to everybody who